Have you ever thought about how what you eat could actually be like the secret to healthier skin?
Interesting.
Or even better,
Yeah.
could just changing what you eat help your patients who have like chronic skin problems?
Oh, wow.
Today, we're going to explore how powerful plant-based diets are
Okay.
for making skin healthier.
Sounds good.
And we're going to give you some practical stuff to use.
Yeah.
Especially for all you healthcare providers and medical residents out there.
Perfect.
Our expert's here to break down 2 new research papers.
Okay.
The first is called Cosmeceuticals, a review of clinical studies claiming to contain specific, well-characterized strains of probiotics or postbiotics.
All right.
It was published in Nutrients. And the second one is the influence of a plant-based diet on skin health, inflammatory skin diseases, skin healing, and plant-based sources of micro and macronutrients from the journal Life.
Awesome. We're going to dive into the fascinating link between what we put in our bodies and how our skin looks and feels.
It all begins with understanding the skin microbiome. So think of your skin as like a huge city,
Right.
totally packed with different microorganisms.
I like that.
These little residents, just like the people in a city, have this super important job of keeping things healthy.
Exactly. It's like a delicate balance,
You
right?
bet.
In a city, you need everyone to play their part for things to run smoothly.
Right.
And just like that, on our skin, a balanced microbiome, and of course diet affects that balance, can help fight off those bad bacteria that cause infections and make skin all red and inflamed.
Okay, so then how does a plant-based diet fit into this whole city that's on our skin?
So research is starting to show that plant-based diets can help create a healthy balance in the gut microbiome.
Right.
And get this good stuff can actually spread to the skin microbiome too. It's like a chain reaction, starting from the inside.
Fascinating. So it's not just about slapping on creams anymore, huh?
Nope.
It's about feeding our skin from within.
You got it.
Now let's talk specifics.
Okay.
How can a plant-based diet actually help patients with those annoying and sometimes really tough inflammatory skin conditions we see every day?
All right, let's start with psoriasis.
Okay.
We all know there's a strong link between psoriasis, being overweight, and metabolic syndrome.
Right.
Plant-based diets can totally change the game here.
Okay.
They've actually been shown to help with managing weight and make metabolic health better, which can help with psoriasis symptoms.
That makes a lot of sense. By tackling those underlying issues, we're basically creating a better environment for the skin to heal, right?
Exactly. It's like setting the stage for the skin to do its thing. And you know what?
Right.
One study even found that patients with psoriasis who ate less processed foods and ate more things like olive oil, fruits, veggies, seafood, and nuts, their symptoms got better.
So it's about getting in those healthy fats, fiber, and antioxidants that we always talk about with plant-based diets.
Right. You're getting it.
Were there any really amazing examples of how this change in diet can make such a huge difference?
Oh yeah, there are even a couple of case studies where, get this, people's psoriasis went into remission after switching to a plant-based diet.
Wow.
Now, of course, we need more research, but it shows the potential.
Really promising stuff.
Okay.
Now let's talk about something that I think a lot of us or our patients have struggled with, acne vulgaris.
Yeah, acne.
What role does food play in this?
Well, it's complicated, but some studies suggest that certain foods might make acne worse.
Oh, really?
Like pork, beef, and even cornflakes were linked to higher acne risk in one study.
Cornflakes, I wouldn't have guessed that. What about dairy? I always hear that dairy can trigger acne.
You're right. Dairy often comes up because it can increase something called IGF-1.
Right.
It's a hormone, and it might be a factor in acne.
So cutting back on those foods could be a good starting point for someone with acne. Now, what about the good stuff?
Yeah.
Are there any foods that might actually help?
Absolutely. There's evidence that eating lots of fruits, veggies, and probiotics can help. In fact, studies have noticed that people in rural areas who eat less dairy, processed stuff, sugar, and fat tend to have less acne.
Interesting.
This kind of hints that a more traditional plant-based diet could actually protect against acne.
That makes sense. Okay, let's move on to hidradenitis suppurativa, HS.
Okay.
It's a really challenging condition that can seriously affect someone's quality of life.
It is.
How does diet play a role here?
Well, just like psoriasis, HS is linked to obesity and metabolic syndrome. And we're seeing that androgens and insulin might be involved too.
So managing weight and blood sugar is crucial for these patients.
Yes.
And since dairy can raise those IGF-1 levels, It might make HS worse as well.
Right.
Are there any specific diet recommendations for HS patients?
There's some really cool research going on about the benefits of the Mediterranean diet for HS,
Oh, okay.
especially olive oil.
Interesting.
It's thought to be anti-inflammatory, so it could help soothe the inflammation that comes with HS. And bonus, the Mediterranean diet is packed with plant-based foods, which ties in perfectly with our topic today.
Olive oil, a common kitchen ingredient that could be therapeutic. Now, what about atopic dermatitis? It's a very common skin condition that often starts in childhood.
Right.
We know diet plays a role, but what does the research say about atopic dermatitis and plant-based diets?
Well, there's evidence linking fast food and red meat to a higher chance of kids getting atopic dermatitis.
So once again, it seems like those processed, high-fat, low-fiber foods are the bad guys for many skin conditions.
They often are.
What about actually intervening with a plant-based diet?
There was this one study, it found that a low-calorie, totally plant-based diet helped adults lose weight, their BMI went down, and their atopic dermatitis symptoms improved significantly.
That's impressive. What about probiotics?
Yeah?
We know they're great for gut health.
All right.
Could they also help manage atopic dermatitis?
Research is still going on, but some studies suggest that plant-based fermented foods like kimchi and sauerkraut might improve the gut microbiome and, as a result, benefit skin health.
Okay.
It's all about that connection between the gut and the skin.
So are we seeing a pattern here?
I think so.
Reducing processed foods, increasing whole plant-based foods, and adding probiotics, all of this can have a good impact on a bunch of different skin conditions.
Yes, it seems like giving the body the nutrients it needs to thrive from the inside out really matters.
Exactly. And that brings up an important question. Can a plant-based diet really provide all the nutrients needed for optimal skin health, especially when it comes to wound healing?
That's a good question. Let's talk about wound healing.
Okay.
Something that I think a lot of us worry about as healthcare providers when we're thinking about plant-based diets for our patients.
Yeah, can a plant-based diet really give the body everything it needs for good healing?
You know, it's a good question. Some studies have shown that wound healing is pretty similar in vegans and people who eat meat.
Okay.
But we do have to be mindful of possible deficiencies in certain nutrients.
Which nutrients are we most concerned about when we're talking about wounds?
Mainly iron and vitamin B12. They're both super important for wound healing. And vegans, might be more likely to be low on these.
Okay, so how should we handle this as healthcare providers? Should we be hesitant to suggest a plant-based diet for patients who are recovering from wounds or surgery?
Not really. I think it's about being careful and staying on top of things. We should check iron and B12 levels regularly with blood tests.
Right.
And if we find someone is deficient, we can recommend supplements.
That seems pretty straightforward.
Yeah.
So it sounds like a balanced approach is key here, making sure patients are getting all the nutrients they need while they're healing.
Exactly. And this brings us to a bigger point about plant-based diets in general. What about other nutrient deficiencies that people might be worried about? It's something we hear a lot, and I think it's important to talk about it.
Right. There's this idea out there that plant-based diets might not have certain vitamins and nutrients that we usually associate with animal products.
Right.
So how can we help our patients make good decisions and bust those myths?
I think it comes down to education and planning meals carefully. We need to show patients that there are tons of plant-based foods that can provide these essential nutrients.
Okay, let's get specific then. Where can people find vitamin A, riboflavin, B12, omega-3s, and protein on a plant-based diet?
All right, let's start with vitamin A. Colorful fruits and veggies like tomatoes, bell peppers, leafy greens, and cantaloupe are packed with it.
Those are all tasty and easy to add to meals. What about riboflavin, vitamin B2?
Riboflavin. You can find plenty of that in asparagus, bananas, beans, broccoli, figs, kale, and lentils.
Wow, that's a great list. Now let's talk about vitamin B12, which is often a concern for people on plant-based diets.
You're right. Some plant-based foods like nutritional yeast, fortified cereals, and plant milk have B12, but supplements are usually recommended for people who are strictly plant-based. We really got to keep an eye on B12 levels and fix any deficiencies.
That makes sense. Now, what about omega-3 fatty acids? We know they're so important for fighting inflammation, but people usually think of fish as the source.
It's true, but plant-based omega-3s are a little different. They mainly provide ALA, which you can find in flax seeds, chia seeds, walnuts, and leafy greens.
So we need to make sure our patients are eating plenty of those ALA-rich foods.
Exactly.
But we talked about how the conversion of ALA to EPA and DHA, the kinds we get from fish oil, isn't very efficient. So how do we make sure they're getting enough of those important omega-3s?
That's a great point. While increasing ALA is a good start, we can also recommend SDA-enriched plant-based options like ahi flour and echium oil.
Interesting.
SDA is a precursor to EPA and DHA, so it helps the body make more of them.
Ahi flour and echium oil? I'll have to check those out. And I imagine algae-based DHA supplements are a good option too.
Absolutely. Algae are a direct source of DHA, and they can even increase EPA levels through a process called retroconversion.
Okay, so there are plenty of ways to keep omega-3 levels up on a plant-based diet.
Now, let's address another big one, protein.
Yes, protein.
Animal products are often seen as the main source of protein. So how can we reassure our patients that they can get enough protein on a plant-based diet?
Well, animal-based proteins give us all 9 essential amino acids, but we can actually get all of them from plants too. It just takes eating a mix of different plant sources throughout the day.
So it's all about variety then. What are some good plant-based protein sources we can recommend?
Oh, there are so many great options. Soybeans and tofu are fantastic, as are lentils, chickpeas, black beans, quinoa, almonds, and even oats. Leafy greens like spinach are surprisingly high in protein too.
It's easy to forget about the protein in veggies, so we're really debunking the myth that you can't get enough protein on a plant-based diet. Exactly. With a little planning and variety, a plant-based diet can provide all the protein, vitamins, and minerals you need for good health, including healthy skin.
And this is where we, as healthcare providers, are so important.
Yes.
We can educate our patients, guide them, and support them as they make these positive changes to their diet that will benefit their skin and their overall health.
Absolutely. It's about empowering both patients and practitioners. It opens up a whole new way of thinking about skin problems and taking a more proactive approach to skin health.
Now, before we move on, I want to go back to omega-3s for a minute.
Okay.
They're so important, especially for people thinking about a plant-based diet. Why are they so crucial?
Well, omega-3s are essential for our brains, our hearts, and as we've been discussing, our skin. The thing is, our bodies can't make them, so we have to get them from food.
And we know they're plentiful in fatty acids like salmon, tuna, and sardines. What are the best sources for someone who doesn't eat fish?
That's where plant-based omega-3s, mainly ALA, come in. You can find them in flax seeds, chia seeds, and walnuts. I always tell my patients to add those to their meals.
Great. But we talked earlier about how ALA doesn't convert to EPA and DHA very well. How can we maximize those essential omega-3s on a plant-based diet?
You're right. Besides upping their ALA intake, we can recommend SDA-enriched options like ahi flour and echium oil.
Right.
These oils have naturally higher levels of SDA, which helps the body produce EPA and DHA. They're a great addition to a plant-based diet.
So ahi flour and echium oil are definitely going on my shopping list. And we can't forget algae-based DHA supplements.
Right.
They provide DHA directly and can even boost EPA levels.
Exactly. With these options, it's totally possible to maintain good omega-3 levels on a plant-based diet.
This has been such an informative conversation. I'm feeling really motivated to use these recommendations in my practice. Let's sum up the key takeaways for our listeners and give them some practical advice before we wrap things up. Okay, so as healthcare providers and medical residents listening, what are the main takeaways from all this?
Yeah, good question.
We've talked about a lot, and it's obvious that what we eat, especially a plant-based diet, can really make a difference for skin health.
Definitely.
So what's the bottom line?
Well, the research suggests that plant-based diets could be a big help for making skin healthier.
Right.
Whether it's dealing with those long-term inflammatory conditions like psoriasis, acne, HS, or atopic dermatitis, or even helping wounds heal, shifting to more plant-based foods could really improve our patients' lives.
But it's not as simple as just telling them to eat more veggies.
Right.
No. Of course not.
Yeah.
We have to give them the knowledge and tools to actually make these changes and stick with them.
You got it. Education is key here. We need to address those worries about potential nutrient deficiencies,
Right.
Head on. And we need to help patients find those plant-based sources of the important nutrients like vitamin A, riboflavin, B12, omega-3s, and protein.
And that's where our expertise as healthcare providers really comes in.
Right.
We can offer personalized advice, watch for any deficiencies, and suggest supplements if needed.
Exactly. It's all about working together with our patients, to come up with a sustainable eating plan that supports their overall health. And of course, that includes their skin.
I have to say, this information has been a real game changer for me.
Yeah, I feel it too.
It's exciting to have this new way of looking at skin health.
Totally.
It's not just about topical treatments anymore. It's about the bigger picture.
I agree. Food is such a powerful tool, and we're just scratching the surface of what it can do.
So for everyone listening, we encourage you, to explore this topic more, think about how these insights can change your practice or even your own health journey.
Yes.
You can find those research articles we discussed, Cosmeceuticals, a review of clinical studies claiming to contain specific, well-characterized strains of probiotics or postbiotics published in Nutrients, and the influence of a plant-based diet on skin health from the journal Life in the show notes.
Awesome. And remember, this is just the beginning. Keep those questions coming, and never stop exploring this amazing world of knowledge.
Disclaimer and bibliography in the description.